take it away.
All right. Um, Hi, I'm Jackie Blumeyer. I'm also part of San Francisco Lifeline with Nick, and there's a few other folks here as well. First, I want to thank you so much for letting us present to you guys tonight this project that we've been pretty passionate about. It's been ongoing for about a year now, and we've already seen a lot of success. So myself, I'm the administrative director for San Francisco Lifeline. We have Nick as the director of operations. I believe Sarah is here. She's our grant director and coordinator. She is working on securing some more grant funding. And then we have Hoy, our community outreach director. And there's quite a few more folks. I don't know if any others are joining tonight, but all of us have a background in working in EMS. Most of us work for the San Francisco Fire Department as either paramedics or EMTs. And then we have some other volunteers who come in from the private ambulance companies in San Francisco, AMR, and King American. So with that, this is San Francisco Lifeline, and I'm going to tell you a little bit about our project. So here's a brief history. Nick came to me last summer with an idea, and we really started getting the ball rolling last October. In December of last year / January of this year, 2023, we received grant funding from the CCHCA, the Chinese Community Healthcare Association. We received a $10,000 grant in order to kickstart our project and begin distributing these Lifeline kits. In March of 2023, we launched our first Lifeline distribution day at 227 Bay Street. And from March until now, we've distributed over 650 kits to residents in San Francisco. Most of these residents reside in CCDC. They're low-income housing sites. And primarily, like, the folks we're trying to work with are those who are monolingual, either Cantonese, Mandarin speaking, or Spanish speaking. We also have Russian translation cards. And we're aiming for folks who are elderly as well, like the 55 and older age group. In September of this year, we received our nonprofit 501c3 status from the IRS, which is super. We're really, really thrilled about that. So we are able to secure more funding and have a tax exemption for our project moving forward. So our concept is actually based off of something that already exists. It doesn't exist in San Francisco yet. But the Vial of Life is actually a concept that has existed for years in many other communities throughout the US. And it's just as you see the picture here, like a medicine bottle with patient information on the inside, and it lives in someone's refrigerator. So when first responders go into a residence, we often look for clues around the house to try and gather as much information as we can when we can't get that information directly from the patient or their family members. So we'll look in medicine cabinets in the bathroom, and we often look in the fridge just to see, is there any medication in there? Do they have food? Are they taking care of themselves? What else can we do to help this person? So Vial of Life was started years ago, and our concept is kind of based off of this idea. So it basically includes a little plastic case holder with an infographic on one side and then the patient's healthcare information on the other side. And what we've been doing is we go door to door as first responders and with someone who can speak the language of the person we're trying to assist, Cantonese, Mandarin, Spanish, etc. And we fill out these cards one-on-one individually with these folks in order to make sure they're accurately completed. We want to make sure all their information is correct, name, date of birth, their health, what medications they're taking, allergies. And we also try to get family contact information, so we're able to contact loved ones in case of an emergency. The card sits in a plastic case holder on their fridge, so that when first responders arrive, they'll be able to find it easily. It'll be mounted, like magnetized on the fridge. We also have stickers we've been placing on the front door of the residence. We often look for clues. We're kind of trained as first responders to look for clues anywhere. We're like mini detectives. And when you arrive at the residence, there's a sticker right on the top of the door to alert first responders to say, oh, hey, there's a Lifeline kit on the fridge. You'll get all this useful and very important information from the patient's refrigerator. So here's the card stock. Here's kind of what it looks like. Everything I've already talked about, but now you can get kind of a visual. The backside has a helpful infographic so that the patient or family members these are some common reasons that folks will call 911, so they can kind of point to what they're experiencing today, so we can kind of start working toward a differential and how we can help treat the patient, while other responders are looking for other things in the household, to help treat the patient. The information is streamlined, so it's just so much easier to access all of this. While we do have access to like phone calls for like language translation lines, sometimes they can take 5-10 minutes in order to get a reliable translator. So all of this information allows us to start treating the patient quickly and effectively. I mean, it's a custom product for San Francisco. The difference between this and the Vial of Life is really that infographic that's on the back to be able to have like a quick, easy translation tool. It's a pretty rudimentary translation service, but those main things that folks call 911 for, there's a lot we can do with just pointing out, I have chest pain today. There's a lot we can go off with that and be able to like treat our patient. And it'll be easy to locate it on the patient's refrigerator. We have run into circumstances where folks don't have refrigerators, and we've overcome that, which is matching up to a wall right by the front door. We have those like adhesive wall sticky strips. And it's really San Francisco pertinent because we have so many folks who speak other languages in our city. So we have a few modes of distribution that we've been working on so far. The primary way that we're able to distribute these kits is our distribution days. We work with CCDC housing complexes, and we've been working with the building managers on site of these housing apartments, and they will go to their residents kind of the day before, the week before our distribution day to let them know like, hey, these folks are coming by offering this free service for you. And then we go door to door on that distribution day, and we're able to answer any questions they have, and we're able to fill out those kits for them. We've also been a part of some community health fairs, and we're working on building relationships with other community-based organizations such as NEMS and RAMS. We're hoping word of mouth is going to be pretty great as well for letting folks know. Oftentimes what we'll find is when we do these distribution days, we'll run into, maybe folks aren't home, they're out and about running errands and such, but we'll be able to reach out to them through the building manager. They say, oh, that room 212 heard from room 213 that you guys came by, they missed you, they would really like a kit. So we're able to do some follow-up with them and be able to circle back and come to them another day. Just a few stats on how our success has gone so far. Primarily our population serve are the Asian and Pacific Islander. We've really been focusing on residents in Chinatown and in these CCDC housing complexes who are Asian Pacific Islander. And then you can see the other breakdown of statistics so far, as well as our method of distribution. By far, 3/4 of our distribution has been through our distribution days, and it's been our most successful means of distribution yet.
So now I'll talk about kind of our vision and how we want to incorporate Code for San Francisco into our project. So like Jackie says, we've been doing this for almost a year now. We've seen a lot of success. We personally see this success as field paramedics in the field. We've run into using the Lifeline, and it's a super good asset for in the field. And Jackie has a really good story of how she used it and kind of benefited patient care in the end. So we want to incorporate San Francisco being the most technologically advanced city in the world. We want to incorporate technology into Lifeline. What we want to do is set up a HIPAA compliant portal that healthcare providers can set up for its community members with healthcare information inside. Through a QR code system, through an app, responders will be able to access the patient's healthcare information through this QR code. In addition, we want to be able to give primary care providers as well as hospitals and emergency rooms the ability to update medical information as necessary. As all of us know, healthcare information is ever changing, and it's hard to kind of stay up to date. And one of the downsides of our current system is that once we set this Lifeline up, this Lifeline is going to be in the patient's household for 2, 3, 4 years. And in those 2, 3, 4 years, things are going to change, and it's really hard for us to update it. But by advancing into kind of a app system where people can update it, we would be able to kind of further enhance our ability to care for our patients and update their information. So how this would work, kind of same concept of what we have, kind of build off of what we have, is same door sticker on the patient's door, just to alert the responders that that a lifeline is in the household, and then the responder will go to the patient's fridge, and from the fridge they'll log into an app, and through the app they'll scan this QR code, and then they'll be linked to our HIPAA compliant portal and be able to access the patient's information. So we kind of just made a quick illustration of mock-up of kind of what we envisioned. So again, same concept. So customized QR code link on the patient's fridge, whether this be in another plastic placard or just a print or a sticker printout, this will go on the patient's fridge. So some things that we kind of run into is that in the traditional household where it's in these low-income families, a lot of it's just male, female, but they have Chinese names or Spanish names that's hard to differentiate between male or female. So we would have all this thing would have is the patient's gender as well as the QR code, just to delineate who this lifeline belongs to during a medical call. And we would distribute these lifelines with the same current models we have, in addition to partnering with primary care offices as well as clinics. And our team is currently building that groundwork right now with clinics through NEMS and CCHP. So if we were to launch this project, we would have a basis for them to kind of start. So first of all, it's going to be there's going to be a login screen, and I just want to reiterate that protecting our community members' healthcare information is our top priority. So we have this login screen. How we want this to work is that each SF responder will receive a unique username and password. And we want to do this by partnering with our emergency medical services agency here in San Francisco. And through them, we would create a unique login password utilizing the paramedics county accreditation number. That way we can also track who's utilizing patient's medical information. After logging into the portal, the responder is going to scan the QR code. And from there, we're going to have something called, we want an additional security screen and what we call a unique ID. The unique ID will be pretty much the patient's street address. So if somebody lives on 2337 Greenwich Street, their unique ID would be 2337. And responders will be notified that this is the unique ID while they're setting up their Lifeline account. And this just provides us that extra layer of protection. And then from there, pretty much access the patient's medical information. We can also include a patient's picture just to kind of make sure that that is the patient. And from there, pretty much the same Lifeline card we have right now. And responders will also have the ability to update the Lifeline if they find any inaccuracies or any issues. And responders can also email the Lifeline team to report a problem, whether it be for the app or just an issue that needs to be resolved, and our team can go set that up. So being first responders, we know first responders best. So we have some kind of keys to success. So again, protecting the patient's information is our top priority. We can't reiterate that enough. That protection is our top priority. And we want to keep the barriers of utilizing this at a minimum. A lot of first responders, if there's a bunch of barriers to utilization, like you have to call a phone number, you have to get a bunch of different steps, they're not going to use it. So we want to just keep it at a minimum. So we want to make this portal as simple as possible to ensure streamlined use. And we also want to ensure this is as user-friendly and as simple as possible. So there's no time wasting on the scene trying to get some unique number, and it's just kind of streamlined to get the information on scene. And that's kind of our presentation. We're open to questions, and thank you so much for listening to us. You can reach us at info@sanfranciscolifeline.com, or you can find more information on our website.
Thanks, Nick, Jacqueline. Does anyone have any questions? Feel free to unmute yourself. I think what we're going to do here is that we're already working on another project in Code for San Francisco and you want to get back to that, the breakout rooms are open. You're welcome to join into that. But we'll stay here in the main room here now with the San Francisco Lifeline team to see if there's a team that's interested in helping to design and develop this. So I see a question from Liv. Who will be responsible for upkeeping the medical data in chat?
Yeah, so that's a really great question. So obviously, us being first responders, we're pretty novice in this type of operation. but we plan on hiring a HIPAA compliance officer, as well as we will maintain the data of the people. So how we envision is that you guys build this platform or portal system for us, and then we will kind of figure out the steps of how we can protect the data as well as maintain the data. And we will be responsible. Our team will be responsible for getting people signed up and all that stuff. In order to fund this project, we know it's not a kind of a cheap project. Sarah has taken initiative. We've applied for a substantial grant through the American Heart Association, and we're also going to be exploring other options to fund this.
Did that answer your question, Liv? Because you talked about, protecting the data, setting things up, getting people on board. But in terms of like updating, you mentioned, this might live in a person's home for 2 to 3 years and their medical condition changes. Who do you expect will be actually updating the medical history data? Is that going to be another part of the outreach, or do you plan to hopefully share this with their actual like primary care provider?
The goal is to share with primary care provider if they have one, or if they have like in-home support, nursing staff and whatnot, that they will be able to do it, or even first responders. Let's say we're accessing their information and we find a new medication on scene, we'll be able to update it as well. But kind of a conglomeration of effort in that sense is to like just give folks access who do provide healthcare for that individual to be able to update it and keep it current. And
Could that also include
can also update it.
Could that also include like family members, like a son or daughter taking care of their elderly parents?
Yeah,
absolutely. Yeah, we're open. I think right now we're kind of just open to all suggestions of kind of building this into the best thing possible. Building off of what Jackie said, while hopefully this app is built, and while the app is being built, we know it's going to take months or even maybe more than a year to kind of do this. We're going to be building those relationships by going to these health fairs, going door to door. We're going to be building relationships with community members as well as healthcare providers in our community, so that when we start pushing this out, we're going to have those relationships and it'll be so much easier to set up. And what we found is that pretty much like all the residents that we set up, they have the same primary care provider. It's the same 15, 20 people. So it's not going to be that hard to kind of like link up with their primary care, because there's not that many out there. They all use the same person. So I think by partnering with CCHP and NEMS, which we already have relationships with, it's going to be able to streamline the process. I hope that answered the question.
So Hugh, I know, Nico, I see your hand up, but I think you may have answered Hugh's question in chat, who's asking about your expected time frame. You were thinking maybe some months over the course of the next year to get this up and running.
Yeah, so absolutely no rush whatsoever. We just want to make this vision a reality. While this is being built, we're going to keep doing what we're doing. So how we've kind of, just for full transparency, how we're kind of doing things is that we are most likely going to get the CCHCA grant for the $10,000 again next year. That will fund our whole current concept, and that's what we're going to keep doing. We're going to keep building relationships with our community members as well as healthcare providers. And whether it takes a couple of years for this app to be built, and once the app is built, we'll start fully transitioning over there. So there's no real time frame, but we're willing to do whatever it takes to kind of get this done.
Nico, do you want to ask your question?
Sure. Yeah, I saw in the presentation, it looked like there are a couple of different use cases, and maybe I wasn't listening closely enough, but one of the problems that it seems like you're looking to solve is like get first responders, patients' medical information as soon as possible on the scene. I also noticed there was the piece about sort of like symptom description, translation. Is that part of the project as well, or is it just the medical record?
Yeah, so let me just kind of paint the picture of a 911 call, right? Let's pretend I'm somebody that doesn't speak Cantonese and I activate 911 because I'm having chest pain. First responders, I'm going to say like 90% of first responders in the city are monolingual and they only speak English. So when they respond to this call, it's pretty much what they call veterinary medicine, because there's no way of doing the translation. People try to use the phone, people try to use their translation service, but a lot of our elderly patients have hearing issues, so it doesn't really work out. So there's no real communication. And what ends up happening is we start rummaging through patients' medications. We try to rummage through their house, trying to find the clues of what's going on. How San Francisco Lifeline aims to help is how San Francisco Lifeline is helping currently is that we have all the medical information readily available. And how we do that is we individually facilitate each one of these kits being made, and we write all the information, and all that information is clear and concise. And that's the information that first responders need. We even go the extra mile to ask about primary care physician information. That's not normally on a vial of life, but that little tidbit is important. If we have somebody that is deceased and we have to contact the medical examiner, that's a vital piece of information they have. So we kind of really brainstorm the medical information piece for this. In terms of the translation guide, it's super important because while we set these up, we kind of talk to them and we instruct them, like, if you're having chest pain, point to it. So how Jackie utilized this on a call recently was that she had a patient with chest pain, and the patient pointed at the chest pain, and Jackie was able to do a full cardiac assessment while getting translation line on the phone, thereby reducing kind of on-scene time and kind of expediting the process. We want to integrate our graphics onto this app as well, but we're open to suggestions and brainstorming of how we do that.
So it's like the medical history handles anything that might be past, and then the graphics or whatever equivalent would handle anything that's emergent or happening in the moment.
Yeah, absolutely. And in terms of the translation, our organization actually has a translation book for first responders, and I can share that with everybody. And that's pretty much open source as well. Anybody can use it. It's free to the public. It's free to our first responders, and we can incorporate this translation guide onto our app as well to kind of streamline things.
Yeah, that's kind of like where our idea came from, as like Lifeline being the next step for San Francisco versus this vial of life concept, is having that simple translation tool, because like minutes matter in a lot of these emergent situations. And if you're able to like do a quick assessment and be able to determine which hospital is appropriate for this patient while trying to get the language line on, like if you can do all of that in 5 minutes and then finally you get a translator, it's like, cool, we're already in the ambulance, thank you, translator, like I'll talk to my patient while we get to the hospital. But the translation tool is really like kind of what sets us like on the next step forward.
And we can also have like a text to speech option utilizing this translation guide that we already have built. This translation guide is literally a picture book, and it has all the stuff, and we can do it like a text to speech thing on this as well. The options are unlimited.
Yeah, I think there's a lot of exciting ways and interesting, fun ways that this could evolve over time. And it's great to hear that you're open to seeing where it might go. Does anyone else have any questions? If you want to unmute or post.
Yeah, I have maybe two. I think the first one is I wasn't quite following the special code, the unique code part of it. But so the idea is you take a picture of the QR code, and then before you can get the information, you have to type in their address. Am I understanding that correctly?
Yes, that's exactly right. That just provides kind of an extra layer of protection, just in case somebody for some reason gets their hands on this app and gets log information. Just provides us the extra layer of protection. Like, we know the street address through our computer automated dispatches, so our responder kind of just puts that code in and just provides the extra layer of protection.
So I guess the next obvious question is, what if they move?
Yeah. So what if they move, right? So I think that's a great question. So what if they move? So if they move, typically our seniors don't move. Typically our seniors kind of stay in their same residence. Like, that's kind of how we notice. Like, if they usually stay in their residence for 20 to 30 years. But if, like, let's say somebody lives in a single family home and they move, I think that we would, again, partner with those primary care physicians as well as kind of social workers to kind of update the lifeline. And that's kind of the infrastructure that we're trying to build right now.
Yeah, and then the other question is kind of a bit of a nitpicky thing. So I've worked with HIPAA compliance, and we are not allowed to actually share medical data with family unless they give us a release of information. Like, they have to sign that, like, and they have to state exactly who they are allowing it to. And just because you're, this person's daughter doesn't mean we can allow you to go in and change that information or have access to it to begin with. So there's definitely some intricacies. Like, I don't know all of the details about who can and cannot access this information. Like, there's there's a list of, like, it's if you're offering a medical service, if you're billing for a medical service, and it's very specific about who is allowed this information and who is not, and most people are not, even if they're family. And I'm not actually sure about caregivers, right? Are they considered part of the medical establishment and therefore can have access or not? So that's just something that we should think about as we're building this out.
Absolutely. I think mainly we would just like our healthcare providers to set this up for patients and update it. I think that's ultimately our goal. And ultimately, we want access. The only way you can access this QR code is through this portal, and we don't want to give everybody an account. So I think that ultimately would just be healthcare providers.
Yeah, that would be a good way to gate it. Like, if you have access to the app, then you are a healthcare professional.
Yeah, I think that's maybe something I should have, when we were exchanging some emails about like a budget for this, is like legal counsel. Like, there are actually legal firms that specialize in like emergency medicine that could help cover some of the answering questions around this and figuring out those issues. Of course, for emergency scenarios, whenever a medical information is needed for the care at the moment of the emergency, there are exceptions now explicitly named in HIPAA rules around providing that information for emergency care, which was specifically to cover that.
Yeah, I think our funding is incorporating kind of getting legal representation for this as well. I think there's a lot of legality around it. And Hoy has actually started reaching out to law firms to kind of start this process. So that's something that we're also exploring.
I think Nico posted another question in chat. Is having a presence, i.e. the QR code in the home ahead of time, a hard constraint? Could we provide health info on the app with just the login info and the unique identifier? I worry about the durability of the in-home component.
Yeah, so that's really interesting, right? So I think that's something we can explore. I think the QR code, you guys are obviously the expert in the programming stuff, but just from kind of in my head, like the QR code would provide an extra layer of protection in the sense of that, like, you have to be involved in the patient's care and enter the patient's home in order to have access to that QR code. And that QR code in the home can just be something that we start with. We're envisioning that we could eventually even do bracelets, because not everybody suffers a medical emergency at home. So if somebody suffers a fall outside, they can have a bracelet or a watch with a Lifeline QR code on it, and then it kind of verifies that, and then we can scan it and still be able to get information on the outside. How we thought about that is that a lot of the people we sign up for notice how important this product is. So they are like, oh, can I like take a picture of it and make it a screensaver on my phone, so if I fall outside, I can show it to them. So that kind of illustrates like the need of it outside of the home as well.
Yeah, I think, although you did a great job of showing us that kind of hypothetical flow, I think it also sounds like you're open to, Janice as a professional designer and he's a researcher, for us to build a team that could really dive into this and kind of investigate what an optimal kind of experience would be, taking into account all the variables. One variable with unique QR codes is like, all right, now what does that do to the cost and convenience of this? Because you can't just go and print out 1,000 cards, right? Because if each one needs a unique QR code, suddenly you've introduced a new kind of change and constraint. Maybe they could be stickers, or maybe they could be something else, or I think it's worth kind of exploring what the possibilities are around that.
Yeah, absolutely. And like I said, like, we're really good at the medicine part and kind of the outreach and the patient advocacy part. And I know you guys are the experts in coding and programming. So we're open to all suggestions and design, making this what it is. And I think having all of us work together, we'd be able to make this app that not only helps San Francisco out and being an open source, it could help pretty much all communities out transitioning into such platform.
Are there any other general questions that anyone wants to ask or get clarification? Otherwise, I think what I'm going to do is I'm going to stop the recording after this.
I was going to.
Oh, go ahead, John.
Yeah, it's sort of along those lines, kind of interested. Well, a couple of things, but one of them is interested in kind of, are you open to that kind of design exploration in terms of maybe doing some research with actual potential patients, going out in the community and seeing kind of how things are done. We've done ride-alongs with the EMTs for the routed project, and that's been extremely helpful and like really useful in terms of generating ideas and thoughts about how to actually build the system. So I think that would be a really valuable step.
Absolutely, we're a completely blank slate. We have this concept, but we don't know how to advance with it. We have Chief Tangerlini's ultimate support, so I think arranging a ride along to kind of get you guys a feel of what we do and how this is going to potentially impact us is a total possible option.
You're also welcome to join in on our distribution days to kind of see like how we've been laying the groundwork thus far to be able to build these relationships with the community.
Anyone else?
The other thing I was going to say is just in terms of like managing logins and accounts and all that stuff, plus then having like sort of HIPAA compliance on top of that, that's obviously a lot of overhead. And so I think it's worth thinking about, are there ways of getting, are there things that are better than nothing? Like, having somebody be able to point to a picture saying, this is my problem right now, is better than nothing at all, clearly. There's something beyond that that doesn't quite reach the level of HIPAA requirements also helpful, that you could have more details kind of accessible via QR code that aren't like, I don't know, personally identifiable or aren't connected in any way to that patient. So you at least can get like, here are some generic things about that patient, but you can't connect them in any way to them. And so the only really way you'd be able to connect that data to the patient would be if you're in their house looking at the QR code. And maybe then you don't have to have logins and all this other stuff on top of it, which can just get in the way of the care and take a longer time.
Yeah, that's actually super important. If we just have the patient's name and date of birth on their physical placard, and then the QR code links to information that you couldn't really tie to, I think that's something that we could definitely explore.
Yeah, I think just looking at ways of not having to have accounts and all that stuff, because it is one more thing to get in the way of when you're actually there trying to help the patient.
Yeah, absolutely. That's actually something that we never thought about. But again, we're a blank slate. We're open to all concepts. We're just super passionate about this, and we just want to see where we can take this.
Any other questions?
Along those lines, have you also considered just having a mobile version of the infographic itself for the translations, like just the, say, PDF, as opposed to like having that on the back of the sheet that you're handing out?
Yeah, we actually have a whole book of kind of translation words that is organized into a formal assessment. But it's a physical book. So I think, like I said just now, we could definitely tie this back into the product. Yeah.
Gotcha.
All right, I'm going to stop this recording. Thanks everyone for the great discussion and kind of Q&A.